And there's a lot of medical advances that I would actually like to see happen in the next 10 years. And these are some pretty realistic things. And since I don't think anybody's working on them, for those of you that are into inventing or patents or whatever, feel free to take these ideas and make millions of dollars. I don't care. But I got some real good ideas on what medical advances should come up over the next 10 years, okay? First, I think we should come up with a pap smear probe. Okay, none of us women like going in for a pap smears. None of us like shaving our legs, right? So they should come up with a probe that you could insert yourself, right? You could do it at home. It'll scan for any HPV. Maybe it could scan for any ominous lesions or whatnot. Then you pull out the probe, it gets red. You kind of stick it in the computer. You know how you plug your iPhone in? Maybe there'll be some USB port that you could clean it off first, where you could stick the probe into the computer. It reads it, and there you're done. That's something that I think could come out. I think it's realistic. I think it's helpful. So you should come up with a pap smear probe. Another thing I'd like to see over the next 10 years is kind of a substitute for cystoscopy. Now, for those of you that have ever had a cystoscope, this is something your urologist has to do to evaluate for hematuria, for blood in the urine, and other bladder issues. And sometimes abdominal ultrasound and renal ultrasound doesn't look at the bladder that well. So when you go to see a urologist, if you've been having, blood in the urine or whatnot, they need to go in with a probe. And it's kind of uncomfortable. I mean, they could use a numbing gel, but I don't really have an idea for this, but that's really something I would like to see. I didn't see that on any of these shows, something that'll substitute for cystoscopy. It's a good test, but maybe they could come up with a scan. Now, one thing that I would take advantage of is, this is another medical advancement that I think is very easy to come up with, is some sort of like helium type injection. You know how helium's in balloons, you have a helium balloon, it goes up to the air, right? It goes up to the sky. So they should come up with like a helium type injection that you can inject into your boobies, right? All of us women need either a lift or we need implants. They should be able to come up with a gaseous material, something that won't hurt or bust or interfere with mammograms, that you could inject into the upper part of the boobie and inflate it. Now, yes, you may have to do multiple injections or do this periodically, but look how much money would save on plastic surgery, and I would use it. So guys, these are great. Honestly, steal the ideas, patent it, all the power to you. These are great ideas. This is something I think is going to be fabulous, all right? My fourth medical advance that we should come up with in the teens is a Kegel-ometer. Now, for those of you who don't know what Kegels are, Jim's going, I want one, right?
Did you say Kegel?
Yes, Kegels. Kegels are these vaginal exercises we do, right? I don't know if you're doing them right now, Jim, but they're these vaginal exercises you do to help strengthen the pelvic floor. Because a lot of us women, after having a couple kids, especially these big-headed ones, we start to lose our urine. And so we're supposed to do these Kegel exercises to, strengthen the vaginal floor and the pelvic floor wall. So my doctor has me doing about 1,000 Kegels an hour. But the problem with this is I lose track after about 700, especially if I'm in the middle of talking to a patient. So if we came up with a Kegelometer, you like those pedometers? They could tell how many, I don't know how those work, how these pedometers figure out how many steps, because, if your leg doesn't move right, I don't know how it picks it up. But if they already have the technology for a pedometer, come up with a Kegelometer. Great. Okay. Another thing I think they will be able to come up with this next decade, and they should, is like a regeneration process for appendages. So like, let's say you cut off your finger, cutting something up, right? Rather than having to, find the finger piece wherever it flew in the kitchen, put it on ice, and then bring it to the hospital, they'll have something that'll just help regenerate the finger, the nerves, the bone, the soft tissue, so then this way, when your mother's yelling at you, careful, you'll cut off a finger. You could say, well, I got that handle because we just regrow the finger. All right. And then finally, I think a very easy, simple medical apparatus that they should come up with this next decade is like a shoehorn for constipation. A lot of people are constipated, not because they can't, transfer the food, from the small intestine to the large intestine and have those mass movements, but they have a piece sitting there that just needs to make the curve, right? You all know what I'm talking about. It's there. It's there. You just don't know how to get it out. So I think they should come up with a shoehorn. I mean, how expensive would that be? They can sell it at Walmart. Easy stuff. All right. Now, another thing for you computer buffs, you guys will make a killing if anybody takes advantage of this, okay? For you computer buffs, come up with a video game where you're going through the colon like a colonoscopy and you're blasting away the polyps. You could sell this to Xbox, Nintendo, whatnot. You're like, pew, 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 pew. You see a polyp when you turn a curve, pew. Knock that out. A video game that's like a virtual colonoscopy. It's brilliant.